Assalamu alaikum. So our today's lecture is about a medical condition called esophageal perforation. Perforation is the piercing or hole formation in the esophagus that may be due to some cancer or may be due to some injury. That injury may be trauma or may be accidentally during surgical procedure by any medical instrument, or some other causes are there. The symptoms will be retrosternal pain and some other symptoms. Retrosternal pain and then means complication will be peritonitis and some other complications are there. Other than the complication, we will discuss about the treatment and investigations. So esophageal perforation. What is esophageal perforation? Esophageal perforation is a hole formation or piercing at esophageal level, esophagus, that may lead to some complications. And the causes are, what are the causes of esophageal perforations are any medical instrument accidentally during surgery, during surgical procedure due to any surgical mistake. The other will be trauma, chest injury can cause esophageal perforation, and then malignancy and post-emetic complication, post-emetic perforation due to severe vomiting. We call this condition called severe vomiting, called Boerhaave syndrome. So these are the causes of esophageal perforation. This will cause some symptoms, some complications. What are the symptoms we will facing? Symptoms will be retrosternal pain. Patient will present with hemoptysis, may present with hemoptysis. Other complications are peritonitis, hard port, peritoneum, peritonitis, and some other complications will be there. What are those symptoms? Retrosternal chest pain, peritonitis, that will cause infection and then will cause septic shock. Other symptoms will, when then there is a chest emphysema, subcutaneous chest emphysema. You find emphysema in non-smokers with retrosternal chest pain, or maybe there will be a finding of hard port, peritoneum, peritonitis. You can assess it will be a peritoneal perforation. Now we will discuss about the investigations. What we will do is simply chest x-rays, or can say abdominal x-rays, abdominal or chest x-rays. You will find the bulging or there is a bleeding symptoms like finding in chest x-rays. Other finding in chest axis in peritonitis or peritoneal esophageal perforation, there is a bubble, there is a air under the diaphragm. In the left side, if you find a bubble or air in the under the diaphragm, that will be that will be normal finding because of the stomach space. But if you find in the right side of the chest, and you find a bubble or a air under the diaphragm, then that will be a clinical sign of what? Esophageal perforation. But you will find air under diaphragm on right sided, that will be a clinical sign of esophageal perforation. Now we will discuss about the treatment. Treatment is very easy. First of all, you will admit the patient in the ICU. Admit in ICU, intensive care unit. Then the first treatment you will do, first thing you will do is NPO, nil per oral. Then you will give IV broad spectrum antibiotics, because perforation will cause infection. Antibiotics and fluids to stabilize the patient. Then you will do, what will you do? Surgically removal of that perforation. That's it. The simple solution of perforation is what? Surgically removal. Until then you will do IV fluids, antibiotics. Nil per oral is necessary, and monitoring, observation of that patient. Now we will discuss whose patients are required for surgery and those are not. Indications for surgery. You just need to learn these things. If patient is presented with severe vomiting, Boer-Haves syndrome, or if he have septic shock, these are the necessary conditions for surgical correction of that perforation. Other than these are what are the, if he has cancer, where is cancer? Malignancy. If he has any malignancy, then you will do, what will you do? Surgical correction. Or if patient is hemodynamically stable, if he is not under septic shock, if the cause is not vomiting, if there is no malignancy or sutures, you will say this patient will survive, this patient will heal without surgery. So what are the indications for perforation? Is indications for surgical correction, indication of surgery are if that patient has undergone septic shock, or due to severe vomiting, Boer-Haves syndrome, or post-emetic cause, or if he has any cancer, then you will surgically remove that part, that perforation is removed surgically. Now that discussed esophagically thoroughly, you will find findings will be air under the diaphragm in the chest, retrosternal pain, mean retrosternal pain, or if the perforation is not perforation is not cervical or mid-astral, you have not need to correct it surgically.